Heart attack is a present day occurrence. It happens frequently lately. It's also known as myocardial infarction, and it is caused when a portion of the muscles of the heart loses its blood supply, either partially or completely. This shortage of blood or an impairment in the blood supply is mostly caused by what we call either an embolus or a thrombus. An embolus is a moving blood clot. It can be a blood clot, it can be air bubbles, it can be fat, that is moving on the blood vessels, and then while it's moving might just end up in a particular part of the body and then get stuck, and then the blood supply on that particular artery becomes impaired. Then a thrombus is a build up of fat or blood clots on a blood vessels. A build up, it just builds up and it stays there. Then when it gets to an extent, the blood supply, the movement of blood on that particular artery becomes impaired. Now, how do you feel? This is how you feel when you have a heart attack. A heart attack feels like an intense chest pain. The one that feels like someone is either squeezing your chest really hard, or that you're carrying a heavy load, and then you end up feeling feeling dizzy. You may feel lightheaded. You may even feel breathless at some point. And then you can also begin to feel like a pain that extends to your jaw and then to your neck also. Heart attack can also happen silently. It's what they call the silent heart attack. It's the one that happens without any obvious symptoms. None of the symptoms of heart attack at all. You don't even feel any pain. It just happens suddenly, and that one can also be very dangerous. Heart attack is not limited to men only. It can happen to both a man and a woman, female and male, and that is why it is important to take care of some underlying medical conditions like hypertension, diabetes, and a high blood cholesterol level, and also to cut down on some of our lifestyle like smoking. When you feel any of the symptoms of heart attack, it is very important to put a call across. Call the emergency room, call the ambulance, or if you can, find your way to the hospital. If someone is there with you, let them take you straight to the hospital. While you are waiting for help to come, kindly chew a tablet of aspirin, because aspirin is a potent inhibitor of blood clots, and it can prevent your chances of death from a heart attack by 25%. Do enjoy your day.